Okay, I'd like to call the November 3rd, 2022 Health Committee meeting to order. We have 5 members present, so we have a quorum. We have minutes to approve from October 6th, 2022 special meeting. It's not a special meeting, was it?
Yes, because you had to change the time, remember?
Oh, that's right, we had to change the time. Okay, thank you. So can I have a motion? Motion by Chung, second by Metzger. Any additions or corrections? Hearing none, all in favor? Any opposed? Okay, that is approved. We do, I believe, have a member of the public that has requested to speak.
We do. If Corey Tello could please come to the table. And again, it's the bottom right button, and you will have 5 minutes to speak.
Okay, I'm Corey Tello. I'm on the Board of Health, and I'm also the chair of the Mental Health Advisory Board. Thank you for this time. I wanted to clarify some concerns that I felt were raised about behavioral health funding at your last Health Committee meeting, and I wanted to urge you to approve the Board of Health amended budget that includes the $300,000 from our fund balance to the mental health services line. This will allow us to fully fund the requests that represent 8 core services from 5 agencies, and that gives us that continuum of services from birth, literally, to full adulthood, from prevention through intensive intervention. And I have 6 points I want to emphasize. One, first, we want you to know we understand the message that tax dollars are to be used for services, not left in a fund balance, which is why the Board of Health approved moving that $300,000 from fund balance. Second, we want you to know that we believe we are good stewards of dollars allocated for behavioral health, as evidenced by a very robust, planful, 9-month process we have for reviewing funding applications and paying close attention to expected outcomes and metrics. We also have input to the Board of Health on funding decisions by a 5-member Policy and Funding Committee and an 8-member Mental Health Advisory Board made up of community members with mental health expertise and boots on the ground understanding. Our stewardship of those mental health dollars doesn't end with giving them. We provide continual monitoring of the effective use of those dollars through reviewing written quarterly reports from the agencies, quarterly formal meetings between our behavioral health program manager, Amy Hancock, and representatives of the agencies, and we have particular emphasis on meeting outcomes written into the final contracts. And Amy actually meets with them or speaks with them very frequently. Third, we want you to know that at the October 12th Board of Health meeting, we approved full funding for 4 agencies that represented 6 programs. We tabled funding on 1 agency representing 2 programs because we wanted to get additional information about possible additional funding streams that might be coming into that agency. However, at our October 23rd Policy and Funding Committee meeting, we approved a recommendation to the Board of Health to fully fund that 5th agency, which is the Center for Human Services, because it was determined that the possibility of them getting additional funding is not going to occur in the foreseeable future. And we felt very important to fund them fully, noting that increased funding will allow them to see 130 additional clients in adult psychiatry program. And we will also be asking that the contract includes language addressing partnering, some ongoing collaborative planning meetings between Center for Human Services and the shelter staff at the Salvation Army and Home Sweet Home Ministries, because we are very aware of some unmet service and prescriber needs for clients at the shelters. Fourth point, money allocated to the target agencies will not go unused. You do not need to worry that there would be money left on the table and it would so end up going back into the fund balance. That is not going to happen. These agencies have a long history of using their dollars for direct services. They do not leave money on the table. Fifth point, we also understand that globally behavioral health funding needs to be continually re-examined, and we need to engage in collective work with our providers to develop a long-term sustainable funding plan. We understand that the way we're doing it right now it won't work year after year after year. So we continually need to work collaboratively to seek other funding streams, including blended funding models. And I'm very glad there's a mental health mental health action plan and behavioral health coordinating council, because I'm sure they will be a big part of that helping look for all of those additional funding streams. And lastly, I want to stress the importance of sending a strong message of support to our agencies. During this multi-year period of unparalleled challenges, they have had to continually adapt to meet existing and emerging needs that are ever more frequent and ever more intense. They have also had transitions at the executive director level and other key management positions within their organizations, and their staff members have been stretched to cover unfilled positions. We need to support them as they stabilize and find balance, as they build new team structures, as they explore new ways of doing business, as they onboard, train, and supervise new staff, as they reemphasize their mission and values and deliver on outcomes. Thank you for your time and your ongoing efforts.
Thank you. We have no one else, correct?
We did have another request to speak, but I don't see her here, so we can move on. And if she comes later, we can address it then.
Okay, thank you. Then moving on to departmental matters, Jason Tabb, Juvenile Detention Superintendent.
Good evening.
Hi. You
Yeah,
have no
my-
items for action, so you have your general report. Anything
Yep.
you would like to point out on that?
Just the increase in number of contacts that we're having with mental health. That number looks pretty big. It's based on the clientele. There's a number of residents who are taking full advantage of our therapists right now, so that number's up for last month. And I think it'll be up again this month on the next one.
Okay. Any questions for Mr. Tabb? I'm glad to hear that they are taking advantage of the
Yes.
opportunities they have for services there. Well, hearing nothing else, thank you.
Thank you.
Next is Diane Hughes, Jail Superintendent, and Taylor Martins, Advanced Correctional Healthcare. And we just have Taylor today. The button on the right.
Hello, can you hear me? Okay.
And there is one item for action. It's request approval of an agreement between the County of McLean and Eric Aberu, DDS. And so can I have a motion? Motion by Martin, second by Metzger. I believe that this is just a continuation contract for the dental services in the jail. Anything else you want to say about that, or? Okay. Anybody have any questions about? Okay, hearing none. All in favor? Any opposed? Okay, so that is approved. And then we have the monthly report, which I like. Every month it looks better. Does anyone have any questions, or is there anything that you'd like to say about that report?
All right. Okay, there we go. We're just trying to work together with jail staff and work from the ACH side to see how we can keep making improvements, keep getting health appraisals done within a timely manner. We are welcoming new staff. We just hired on a few new individuals to kind of ease the process of flow. So hopefully we can continue to make improvements, and I've been taking feedback and doing my best to kind of work something out to meet those needs.
Okay. Any questions from the committee? Okay. Hearing none. Thank you. Next, we have Jessica McKnight, Health Department Administrator.
Hello.
Hi. And you have no action items today, but you do have your monthly report. Is there anything you'd like to point out on that?
I just wanted to highlight that we have expanded COVID-19 testing. So not only are we offering the nasal swab, but also the saliva shield testing. And now we have moved actually to 200 West Front Street, the 4th floor. So we're there now Monday through Friday from 11 to 1. So we've expanded testing other than obviously county holidays. So that's good news.
Okay. Any questions from Member Martin?
Not sure it's, yeah, it is a question. How are we doing with monkeypox? I saw that there was some information came out today that we have it in Illinois, but I just want to know how we're doing in McLean County, if we're ready, if not.
Yes, yeah, we've now had 3 cases total since the beginning of the outbreak, and so we are still doing okay with vaccine. So we do have vaccine on hand and are administering as needed to those who qualify. And again, things are in the state and the nation decreasing cases, so that's good news. But it's possible, likely maybe, that monkeypox is going to be something that we do see going forward now, just on a regular basis rather than these small outbreaks. So we are prepared and we're responding as needed.
Anyone else? Member Bell?
Yes, I want to thank you for keeping us updated on it. I was very concerned when I first heard about it, and I wasn't trying to be too harsh on it, but we didn't know very much about COVID, and then COVID kind of took over our lives. So I would like to thank you, Ms. McKnight, for keeping us abreast of what's going on in your department. Thank you.
course.
Member Chung?
Thank you. I've been reading a lot about RSV, and I was just wondering if you, I guess, if the health department is, I don't know, hearing things about it, or if you're putting out any information about it as cold and flu season is, probably ramping up here.
Yeah, we're definitely hearing about it. Some information coming out from IDPH, just making us aware and making also our healthcare partners aware of what's being seen, across the nation and the state with pediatric units seeing lots of cases in the hospitals. So just kind of what information can we provide for any, respiratory illness, how to prevent that and how to reduce that spread. But it's an unusual season so far, but we did see RSV, I think it was last summer, we saw an increase in cases. So it's kind of going as, we aren't wearing the masks now. We're seeing some of those respiratory illnesses that we typically do see this time of year increase.
Anyone else? Member Metzger?
I just want to acknowledge that you had 2 members of your staff that have been named to the Illinois Department of Public Health's Office of Health Protection, and they're going to be working on establishing statewide standards for food safety. So I think that is, please let them know that we acknowledge their efforts and we appreciate what they're doing. That will not only help our county, but obviously the entire state. So please let them know that we appreciate their additional efforts being on that team.
Will do, yes. Yeah, we were lucky to have a very knowledgeable staff and all throughout the health department, but especially in environmental health.
Anyone else? Okay, thank you. Next is Tim Wiley, Nursing Home Administrator. And you have no items for action, but we do have your general report. Is there anything you would like to highlight? I'm sure there is.
Well, first of all, I want to thank you for the privilege of this being my 12th meeting to attend. It's been a wonderful 12 months so far, and we're planning on maintaining that traction and looking for other areas where we can raise the trajectory in the performance of the home. Census was relatively stable through this period, which is not uncommon for the market this time of year, but recruitment of staff has been so strong. It's been my delight to watch my HR director exhausted. That's a good thing. She's doing new hire paperwork constantly, it would feel. We're starting to see recruitment of nurses, and I attribute that to word of mouth. I had 3 primary objectives when I was invited to be a part of this team. One was to prove the viability of the McLean County Nursing Home. The second was to become the provider of choice in the Bloomington Normal area. And the third was to become the employer of choice in our industry in the area. And trying to be objective as I can be. I feel like we're moving in the direction of all three of those things, especially with the recruiting. We weren't seeing very much nurse activity, and the nurses who are coming in are hearing and sharing with us that you need to go work at McLean County. And I live for that stuff. Revenue is staying strong, but the exciting news obviously is our agency utilization for the month of September was 22%, October was 21%, and we expect to see that trend continue.
Does anyone have any questions? Member Martin?
This is my last meeting, so, no, okay. This is my second from last meeting. I stand corrected, thank you. Are we still looking at the name change from the blue ribbon panel that we were talking about? Changing the name of the nursing home? Is that still out there?
If I may just insert my opinion, I feel like that would improve our relevance. I actually just had this conversation with the director of nursing this week. It's been interesting, but I don't feel like it's holding us back, and that's exciting, but it's antiquated. And if we did rebrand, these are not necessarily the views of the county administration, the McLean County of Illinois. These are just my views. I think it would make us a little more relevant, but I believe our rebranding would still need to be clearly McLean County, not a rebranding that makes us sound like a resort in Ixtapa. We take care of seniors, and some sort of senior health branding I think would be appropriate. It would identify the industry that we're in. There's just a lot of negative connotation to the phrase nursing home, but I think through the years, McLean County Nursing Home has crawled into the hearts of the people of McLean County and has found a warm spot there. So I don't think it's critical to be sustainable. I just think it's something worth consideration purely from a relevant standpoint.
Anyone else? Okay, thank you.
Thank you all.
Okay, next we have Cassie Taylor, County Administrator.
So I do have one long action item on the agenda. It is a request approval of the Health Department fiscal year 2023 recommended budget and includes the funds for Fund 112.
Do I have a motion? Motion by Chung, second by Martin. Okay, so first, I think, and I've talked to most of you, we received a memo from Ms. McKnight about the amendment that the Board of Health would like to make to the budget for $300,000 at in Fund 6160. And so in order to do that, to change the budget that we were presented, we need to have a motion for that. And so is anyone, motion by Chung, second by Bell. Is there any discussion or Member Metzger?
I just want to acknowledge our speaker and appreciated her insights and her information that she shared. I just wanted to make a couple of brief comments, and that was, I don't think anyone, just because of our discussions last month, I don't believe that there was any question in this at least from my perspective, of need. I believe that when there is a need, that the county board and certainly this committee and me as a member of this committee will support any need. And so if the impression was given that we don't support the agencies, I apologize for that. That's not our intent. We absolutely support these agencies that are providing services, needed services to our population in our county. What my focus was, and it was truly, I can only speak for myself, was to avoid placing more money because EAV goes up and other things happen, additional salaries come in, or additional monies come in. Just did not want to see additional monies go into that reserve. That was my focus, and so I certainly support this. We've had some real identified need, specific organizations, and where that money will be spent, and I can certainly support that. And I also, like I said, I wanted to give the, clarify that there is not a concern that there is a misuse of monies in any way.
Thank you. Anyone else? Okay, hearing nothing.
Can we clarify what the
okay,
amended
yes.
motion is, please?
So the motion, I believe, is to increase the 112,061.60, 400.0000, increase that to 300,000, increase that revenue line, and then increase the expenses line in that same fund, 0706002, increase that 300,000 to $1,730,997. That's pretty much what the memo says that we received.
Thank you.
Okay. We already have a motion. We have a motion for that particular item. We have a motion for the whole thing, and then we have a motion, I think, for,
To amend the mental
to
health
to
program.
amend that part of it. So we're voting on that one motion. The amendment, yes. This gets confusing sometimes. All in favor? Any opposed? Okay, so that passed. Now, for any other discussion on Fund 112? Member Chung.
Yes, thank you. I also wanted to sort of clarify some of the discussion from last month, at least for me, and I thank everybody Ms. Dreyer, who sent a lot of these emails with numbers and everything. For me, my concern last month was just the fact that numbers were being thrown out. I did not feel comfortable sort of voting on this without actually looking at how things would be impacted. So I really appreciate things being sent out so I could look at that more, and I do feel comfortable with what we're doing today. So I appreciate all that. That was just my sort of concern last month. So I just wanted to clarify that. I guess one small question, I guess a question that I just have, because I was speaking with a couple of my other colleagues who are not on this committee. They wanted, some of my colleagues wanted to sort of know how we ended up with this sort of surplus, if there's a sort of history as to why we have such a surplus in this fund. If anybody, I guess, would like to clarify that, that would be lovely.
I guess I could provide some history. And it begins way before I was ever on the board. As you know, the Board of Health provides a budget to the county and, or the health department. And so over the years that had been built up, and the budget was created and then funds were not all spent. And so eventually you start building fund balance. If you don't, I mean, just think about your own personal budget. If you, make X number of dollars, but you only spend, a lot less, you're going to eventually save some money and have a savings account. So has been building for many, many years. I mean, like I said, long before I've been on the board, and I've been on the board for 12 years. So, and there, I mean, it has been as high as over $5 million at points. So, it's something that the funds, and some of the logic was about if there was ever a pandemic, and having funds, thinking that we would have to expend all these funds. Well, now that we've gone through a pandemic and we know that there is funds that came in that we really didn't spend much of our own funds throughout the whole COVID thing, that funding came through federally, statewide, and stuff like that. So that need has been kind of diminished in a way. And so it needs to be then addressed. I mean, now that we know and what Ms. McKnight feels, is going to eventually get to a point where we're comfortable with knowing what we would need if we had a pandemic. Even with the monkeypox, you can see that the state is doing much of the work and it's not on the health department. So, excuse me. So that's kind of a little bit of history without going into a lot of other things. But that's how we ended up where we're at. And then when you see that EAV continually goes up, and you budget for something, and then like if you looked at that one worksheet that Ms. Dreyer sent out, that the EAV, the projected balance, fund balance at the end of this year is $300,000, over $300,000 more than what we had at the end of 2021. So that's how you get that fund balance that builds up. And sometimes it can build up very quickly when EAV changes or you don't spend all your money or anything like that. So that's kind of a short history, and I is that enough for? That's great. Okay. So that is why, in order to right-size the fund balance, this is where the levy discussion comes into play. Because if you continually levy the same amount of money, you're never going to spend that fund balance. So that's where we need to right-size the levy and get it to a point where the fund balance is correct for the health department, for them to do their operations, and yet, not be sitting on a bunch of money that's not helping anybody. So that's how that came about. So, Member Metzger.
I was pretty assertive last meeting. I felt we needed to reduce that fund balance significantly. And my proposal was $700,000. However, I would like to, at this point, make an amendment to that budget that we do a levy reduction of $300,000. And the reason to kind of shift gears from 700,000 to 300 really has to do with that that mental health program, because there'll be an additional 300 coming from there. And after a lot of looking and soul searching too, determining that we don't necessarily want to see these ups and down fluctuations with the budget. I really do not like to see huge fund balances. It's taxpayer money sitting in a savings account, and that's not what we should be doing. You made a good explanation, Chair Schaefer, that how it got there. But I really think that it would be helpful to go ahead and continue to see a little bit more taken out of that fund balance for this coming year, but not to the degree as what I proposed last month. And I think it was probably wise on the part of my fellow board members or committee members to back away and get better numbers so people could understand that. I was pretty passionate, and for that, I'm not going to apologize, but I am going to say that I felt we needed to start addressing it. So my recommendation or my motion to amend would be to, and these are numbers that Ms. Dreyer helped us come to, I think, and that is to have a reduction of 300,000, meaning that we would have to take money out of that reserve fund, and that would be reduce 401,001, reduce 300,000, and that would get us to 168,663, and then that 00400.00 increase that to 100 or 300, excuse me, and that is my motion.
And that would be in 112-0061-0061.
Correct. Yes.
We have a motion. Is there a second? Second by Member Martin. Discussion? No. Member Bell?
The people that I represent is primarily ISU students. This pandemic has caused a lot of mental issues, and they are coming to me and asking me, what are we going to do to help them navigate the new normal? So I hope that we are able to service them along with the high school students that live by me and the junior high students that are just now trying to get their footing back. We have noticed that grades are failing because the pandemic, they were at home, they were dealing with a lot of mental issues. So I hope that we can all address this once we start getting the numbers in from the health department and other departments, and we can come to the table and do something good for 2023. Thank you.
Thank you. Member Metzger?
I believe we should have been able, and I think that our mental health program, 0060, I think that was the intent of that particular increase of 300,000 out of that reserve fund. I believe that was where that is kind of that focus, not solely, but I think it will include a variety of needs. So I believe that 300,000 should help there. I'm not sure that that 300,000 is going to address those issues that my amendment will necessarily address those issues.
Thank you. Any other comments, questions? So we have another amendment to reduce the levy by 300,000 with the line items that Member Metzger had mentioned. All in favor? Aye. Any opposed? Okay, and that is approved. So anyone have any other adjustments to the 112 that they would like to make at this point? Otherwise, we will go back to our original motion with the two amendments. Any discussion there? Okay, hearing none. We are voting on the two amendments and then that would approve the 112.
Yeah, you're voting on the original as amended.
The original as amended with those two amendments. Julie has to get the language right. All in favor? Aye. Any opposed? Okay, thank you. So the 112 has been approved. Moving on is other County Administrator, do you have anything else? Okay. Moving on to other business and communication. Yes, this is not our last meeting. We do have a meeting on December 1st at 5:30, which is the last one for this committee because the new board then gets sworn in on December 5th. So that's why we will be meeting again in December, and that will be our last meeting. So just, huh? Good to know, yes. So you need to make sure you show up, okay? Thank you. I need to make sure I show up too. So anyway, just want to make that clear for everyone. So anybody else have any other business or communication? Other than that we're all extremely busy since it's election season. Except you, yeah. And Hannah, who's not here. Yeah, we're going that direction, okay. I have, for bills and transfers, the auditor has reviewed all the bills and they comply with all of our ordinances, resolutions, and policies. And so, jail and JDC Medical has a prepaid total of $10,861.27. Motion by Martin, second by Metzger. All in favor? Aye. Any opposed? Okay, that one's approved. Board of Health has a prepaid total of $269,557.67. Motion by Metzger, second by Chung. All in favor? Aye. Any opposed? Okay, Board of Health is approved. Nursing home has a prepaid total of $284,976.81. Motion by Chung, second by Bell. All in favor? Aye. And there must be one that's stuck here. The Developmental and Disabilities Board has a prepaid total of $71,551.95. Motion by Bell, second by Martin. All in favor? Aye. And with that, we are adjourned. Thank you all.